Hi, I'm Louise Moir, and I'm a nursing faculty here at Anishinaabeg Educational Institute, and I'd like to show you our classroom. So we're really excited. This is Nursing Anne, and she's one of our simulators that we have here that we practice on. And she has breath sounds, she's actually breathing, heart sounds, we can do blood pressure, pulses on her. We can see all of her vital signs there on the monitor. And so during different classes, we can actually program different case studies with Anne to portray a patient that we might see in the hospital setting or long-term care setting. This patient actually can talk, have different sounds. And so the students can learn on Nursing Anne, so they can go through the different assessments, talk with her, give medications to her, and this is a safe learning environment. So if they make a mistake, nothing is going to happen to Anne, and we can learn from those mistakes and talk about them. We have different wounds that we can put on her. So if we're learning this week on how to do wound care or take sutures or staples out, we can put that on the mannequin and we can actually practice so that we are confident when we go into the clinical area and have to do it for real. So one of the very first skills that we learn in nursing is to take vital signs. And so one of them is to take blood pressure. And so we can practice on each other, or we can practice on the mannequin in Nursing Anne. And so we can do that to get a different reading. And so during a simulation, the instructor can do different programming of the mannequin, and so students would then have to recognize, is this blood pressure different for this patient, and what do we need to do about it? So it's a great way to learn. It's experiential learning, it's hands-on learning, and again, this is a safe learning environment to make those mistakes. So in addition to Nursing Anne, we also have a baby simulator. And so part of the role of a registered practical nurse is to look after babies, whether it be in the hospital or doctor's office or the community. And so we have a baby here that again is controlled by tablet, and we can practice different assessment skills on this baby. So we can practice what it sounds like to listen to a baby's heart, which is much faster. We can practice newborn care, so what it's like to diaper, to bathe a newborn baby, as well as doing other assessments. And another thing that we have over here is an electronic medication cart, which we're seeing a lot of in the clinical agencies. And so we use this as well in classroom when we're doing simulations. And it provides us with a realistic opportunity to learn on it. So you would scan your patient's armband, it would open the drawer, scan your medications, and it's another safe way of administering medications to your client. So even the equipment in our nursing lab is new and current and stuff that you would see in the clinical settings. So our beds are brand new SmartBeds that have different controls, different functions that we can do. And so what's great is students here can get comfortable around the equipment. So when they go into the clinical setting, they're able to operate the equipment that's there. So this particular mannequin here, simulator, she is set up what a woman would be like after giving birth. And so we can actually practice the different assessments that we would have to do for a woman following delivery of a baby. We also, as I mentioned earlier, we can have different wounds put onto the mannequin. So depending on what we're learning that particular week, we can do the dressing changes for the patient and the students get to practice. So this is your classroom where we would listen to lectures or practice at the bedsides with the equipment that we have, and we would love to welcome you here to the Practical Nursing program at Anishinaabeg Education Institute. So please feel free to reach out if you have any questions. The contact information for the AEI staff is on the website, and we'd be more than happy to answer your questions.